Good day, listeners and viewers. On today's COVID-19 update, Minister of Health Dr. Frank Anthony assures that there are enough COVID-19 vaccines for Guyana's adult population.
Can you say how many second doses of Sputnik V came earlier this week?
Well, this week we had about 10,000 doses that came in, and we are expecting to get these allocations coming on a regular basis until we exhaust the amount that is pending.
How many doses came in the shipment earlier this month?
5,000.
What steps are being taken to test for those variants?
Well, as you would know, we initially had some tests that were done by CARFA, and the first set that we had sent, of the 10 samples that went out, we really didn't see any variants. However, we saw in subsequent reports that they have found variants here. And as you recall, we were trying to find that out because we did not get an official report. We'll continue to work with CARFA to see if we can get more testing done to understand what variants are circulating here. And we'll try to find from other institutions who have the ability to sequence the SARS-CoV-2 genome to see whether or not we can get other people to look at it. I know PAHO has a network of laboratories in Latin America, and that's one possibility that we can work with them to see how we can improve gene sequencing. But having said all of that, the thing here is that our public health management would not vary much, in the sense that people would have to still abide by the rules that we have, and that is social distancing, wearing of masks. You will still have to continue those, and of course observing these things, because I think people have gotten very complacent. Now, the other thing that would help, whichever variant we have, is certainly for people to get vaccinated. Because we know that persons who are fully vaccinated, they would, if they do get the infection, they would experience a milder form of the infection. Now, some time ago also, I would have stated that we are assuming that we have all variants here. And because of that, we want to encourage people to take seriously these public health measures that we are advocating. And plus, we would have seen from a clinical perspective that we, at one point, we had more hospitalization. That has dropped slightly, but it doesn't mean that we don't have the different types of variants circulating. So, from a clinical perspective, we can see when you have aggressive strains of the virus, because we're seeing more hospitalization, we're seeing more people in the ICU, and so forth. So I want people to take the common sense measures, and those, as I've stated, but more importantly, for people to be vaccinated, because that's the only way that we can safely ride out the third wave.
Now, today we're joined by journalist Ms. Nadine Ragbir from Prime News.
I just wanted to know, is mandatory vaccine on your legislative agenda? I ask because I see certain agencies have already taken steps to ensure that their staff or persons that they're associated with get the vaccine before they come to work. The Guyana Defense Force is one. I think GIFLAN has been doing some amount of thing. And there are other agency, private sector bodies. Do you see this as the way you're going to go for this particular vaccine, given this pandemic?
A couple of things here. Since COVID started in 2019 in Wuhan, we have seen the evolution of the virus, making it, in some cases, more infectious. the current strain that is now dominating around the world is the Delta variant. And Delta variant is more infectious. Um, it also causes more hospitalization, more deaths, and it has, in some instances, the ability to break through, even with persons who have been vaccinated. So this variant is a very serious variant, and we would have seen the consequences in some countries, like in India, where literally thousands and thousands of people died from this particular variant. This particular variant is now in several countries, probably more than 60 countries. And in the United States, it is now becoming the most dominant variant and the cause for most of the cases now in the US. But what they're seeing is the people who have been vaccinated, if they do get infected with this particular variant, they'll have a different set of symptoms. More than likely, they're seeing symptoms such as headache, sore throat, runny nose. So it's more flu-like. And very often, these people would have these symptoms. They're mild. They don't require hospitalization. And they'll be okay after a few days. But for those who are unvaccinated, you have a challenge where you're seeing more cases of hospitalization and deaths. And because of that, countries now are taking a very serious position. So in the United States, as of the 26th of July, California has now mandated that all state employees must take the vaccine, and they've been given a particular date by when they should do so. Immediately after that was done, you had New York stating the same thing. And on the same day, the French government passed legislation pertaining to mandatory vaccination. And also, now if you want to go to a restaurant in France or access certain services, you have to be vaccinated. So more and more countries are going in this direction because they recognize that unless the population is fully vaccinated, you are going to have challenges with people getting sick, people dying, and in many instances it can overwhelm the health system. Here, there's a lot of the private sector entities would want to make their work environment safe, and they are taking those precautions. So they're giving their employees the option that either you go get the vaccine or you'll have to be tested on a regular basis for them to verify that the person is not infected with COVID. So that's what I observe a number of the private sector entities doing here. And you got to understand that that's one way of encouraging a safe environment. Now, if it's a public, a place that offer service to the public, you're not only putting your co-workers at risk, you're also putting the general public at risk if you're not vaccinated. So I think more and more as people get serious and understand the implications of this virus, that you will see more and more people trying to implement systems like this. We are looking at what is evolving from an epidemiological point of view, and we would take all the necessary steps to ensure that people are protected. So as of yesterday, we've had 248,970 persons who would have received a first dose vaccine. That amounts to about 51.1% of our adult population. We have also, as of yesterday, 133,987 persons who would have received a second dose vaccine, which means that they're fully immunized now. So that accounts for 27.5% of our population. Mosquitoes transmit some types of diseases, which include malaria, chikungunya, Zika, dengue, and so forth. They don't transmit COVID-19.
This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or health.gov.gy and our social media platforms.